So this was initially supposed to be a virtual presentation on Zoom, but got changed to in-person. So the formatting is a little different, but I'll take it away from here. So this study is about comparing functional outcomes in ACL reconstruction based on the type of graft choice. So this study looked at quadriceps tendon versus BTB tendons. And so BTB tendons and hamstring tendon autografts were initially used as the standard tendons that are used for ACL reconstruction. But due to its clinical stability and low complications associated with harvesting, the quad tendon has received a lot of interest recently. In general, both graft types have been shown to have favorable functional outcomes. But the objective of this study was to compare the postoperative outcomes between the standard BTB and quadriceps tendon autografts. And then the second-fold goal is to compare any complication incidents with these two types. And so the methods were similar to the first study we mentioned. So the systematic review of PubMed, Embase, and Cochrane libraries. We included studies published within the last 20 years. All of them were randomized controlled trials, and patients either underwent a BTB or a quad tendon autograft. And these studies focused on looking at post-op stability and functional outcomes. And so we excluded any animal or cadaveric studies or any studies that weren't RCTs. And we also excluded articles that had other types of grafts, such as hamstring autografts. And so this table, which is probably tough to see, summarizes our review process. So we started with 348 sources through database searching. 285 of them were duplicates, and then we manually screened 285 studies and ended up with 6 that fit all the inclusion and exclusion criteria. And this all followed the PRISMA reporting guidelines. And so this is more of an overview of the number of patients in each study. All of them were retrospective, all of them were RCTs. And so our results, out of the 6 studies that we included, 1/3 of them found no significant difference at all in terms of outcomes or complications across the 2 graft types. One of them found that the quad tendon autograft had improved knee function compared to the BTB autograft. One of them found that, excuse me, one of them found that the quad tendon autograft had significantly reduced quadriceps index postoperatively. So this is a measurement of the range of motion of the quadriceps and any pain associated with moving. One of them found that the 2 autografts had equivalent functional outcomes, but the quad tendon had less anterior knee pain with the harvesting, which makes sense because the quad tendon is located above the knee, whereas the BTB is sort of closer to the knee region. And then the overall IKDC score, so that's a measure of overall functionality of the knee, is reported as normal significantly more often in the BTB autograft group compared to the other group. And donor site morbidity was found to be greater in quad tendon autograft recipients in this study. So the overall key takeaway from all these results is that patients that undergo ACL reconstruction with either graft type, they both had an increased post-op knee functionality and increased knee stability after operation. And there's no statistically significant difference in complications requiring reoperation in either group. Revision secondary to graft failure is not significant in either group. And so our takeaway here is that both quad tendon and BTB autografts have similar clinical significance and functional outcomes after operation. And so surgeons can use this information to help educate patients on discussing choosing a graft type because both grafts are functionally almost equivalent. Thank you. I can answer any questions.
All righty, thank you. Any questions?
More significant in the market population.
Right. Yeah, so some of them, so the Walston study had 212 patients, which was a very large number. And the Gorshevsky also had 260. So these are sort of had a larger N value. The next step here would be to do a weighted analysis, and that can allow for the studies that had more data points to be included at with a higher weight in a meta-analysis fashion. And we haven't taken that step yet, but we didn't find that any of the studies had a really small number that would skew the results.
Just one quick question on your PRISMA. I'm just curious, what were some of the common reasons articles were excluded? Because it looked like you all kind of got 285 and then you excluded 274. I'm just curious, what were some of the common reasons why you ended up excluding or feeling some of the studies were relevant to the analysis you are doing?
Yes, sir. So A major goal of this going into it was to include only randomized controlled trials. And so the study design, a lot of studies were based on previous RCTs or review of RCTs. But we really wanted primary data, and that was kind of difficult to come by. So that's why we trimmed it from 285 to 6 pretty quickly. All right, well, thank you.